To the Point with Michael Williams.
Enrollment is underway in what could be a crucial year for the Affordable Care Act insurance program. It's the first time it will be happening in the Trump administration. Good morning and welcome. President Trump has tried to end Obamacare and says it is imploding, which has placed a cloud over the insurance program. It exists, but there have been changes. Joining me to discuss the topic, Louisa McQueeney. She worked as an Affordable Care navigator and is now with Florida Voices for Health, a healthcare advocacy group, and we thank you so much for coming in.
Thank you for having me.
Enrollment began, a lot to unpack. Where do we stand with startup of enrollment? Palm Beach County and the Treasure Coast. Let's begin there.
Enrollment began November 1st. One of the big changes this year is that enrollment, the open enrollment period is from November 1st through December 15th. In previous years, it was 3 months. It went through the end of January, so people have to pay attention that they need to enroll before the 15th of December.
We talked just before we went here. I want you to repeat that because it was something crucial you didn't want people to forget.
Enrollment this year is from November 1st through December 15th.
That's so crucial.
It's very crucial. If they don't
it's enroll, a much shorter enrollment period.
It's only 6 weeks, and if they don't enroll by the 15th of December, the marketplace will re-enroll them either in the plan they had previously, or they will pick a plan that is very close to the plan they had before if the carrier no longer carries that plan.
How many people take care through the Affordable Care Act in the Palm Beaches and Treasure Coast, the numbers you have?
The numbers I have, I'm not exactly sure how many there are in this county and the Treasure Coast, but it's quite a substantial number.
And Florida has more people under the Affordable Care Act sign up.
1.7 Floridians.
1.7 million Floridians, more than any other states, as I recall.
More than any other state.
So that leads us to our next question. Talk about changes. What should people be looking for? And let me begin with this. All the publicity has been around the fact that the president drawing away subsidies that helped reimburse insurance companies for the lower premiums for those who could least afford them. By drawing those away, and now Congress is trying to come up with a solution for that, but all of it's up in the air. Where does the Affordable Care Act stand on affordability for people right now? What are the things you're seeing? What are the kind of questions you're getting?
The people that get financial subsidies through the Affordable Care Act, it's about 94% of Floridians actually get some financial assistance. I did some research this morning before we were talking here, and once you put in the numbers, actually it's not bad at all.
Talk about that.
People think that they're going to see 45% increases. That's been in the news. You know, we're seeing 45% increases in the state of Florida. If you receive subsidies through the Affordable Care Act, you're going to probably pay about the same, maybe a little more, and some places a little less. I checked Palm Beach County and Martin County, and I checked on certain age groups. Some of them are exactly the same. Some of them are maybe $10 a month more. Some of them are actually maybe $5 a month less.
So the question about subsidies being withdrawn or ending that is the political fight over Obamacare. Correct. At least for this year's enrollment period, it seems like early on that's not going to be an impact. Now, years outbound, it may well be a gigantic issue, but right now the politics hasn't caught up and really changed the affordability yet.
Correct. For 2018, I advise everyone, if you are in the individual market under the Affordable Care Act, go on healthcare.gov, reapply, even if all your information is there, reapply and go through the plans. There's plenty of plans available. There's 56 plans in Palm Beach County. There's plenty of plans available. Make sure that you get the financial assistance that you're entitled to.
And again, how many, the percentage that will qualify for some form of subsidy?
It's about 94%.
So virtually everyone, at least this going. Of course, you do have long-term concerns. The debate in Washington about pulling away those subsidies had insurers up in arms. There's a push bipartisan push going on in Congress to try and work on that aspect of it for the outbound years. Those are large, longer-term concerns for you.
Correct.
Talk about the choice, and I want to let you know at home, if you have a loved one who's on the Affordable Care Act or needs that kind of help, towards the end of our segment, we're going to talk about where you can go, because it can be a dizzying array of options. But you basically have what? Silver, gold, platinum choices. You've got a whole array of choices. How do people pluck through and weed through those?
When you sit next to a person and you're trying to figure out their healthcare situation, there's a couple of questions. Price is one. health is, even though they're not being rated by any health status or whatever, but some people will tell you immediately that they need a certain type of medication, they love their doctor, they want to see a doctor. So a lot of the time you are picking plans on people's personal preferences. Some people don't care, they just want the cheapest plan because they're healthy. So it really is a very, very individual choice for every person.
You say a lot of choices remain in Florida. Are there as many companies offering
in Palm Beach County?
In Palm Beach County.
Yeah.
Talk about Palm Beach County. Talk, if to the degree you can, about the state as a whole. We hear so much about the number of insurers willing to be part of this program. Given the political uncertainties is shrinking, what are you seeing in Palm Beach County and beyond? Do we have the same number of insurers involved?
We have less insurers involved in Palm Beach County too. We still have 56 plans. There's 3 insurance carriers in Palm Beach County.
And they are?
Florida Blue, Embeddor, and Molina. But there's, I believe it's 37 counties in the state that only have 1 carrier, and I believe it's Florida Blue. Like, for instance, the whole northern part of the state, that's all Florida Blue.
Will those people outside of, let's say, Palm Beach County, and are some of our Treasure Coast counties down to 1 insurer?
No, I believe Treasure Coast has more than 1.
So a better situation here. Let's look outside this area. For those counties where they're down to 1 insurer, will they still be fairly affordable plans comparative to last year?
Yes.
Even with the number of insurers drying up?
What I've heard anecdotally, we just started, this is November 3rd today, so anecdotally what I've heard from the navigators around the state, yes, there's still affordable plans.
What about the cost for an average, say, silver plan? We're talking about numbers. What would a price look like on that?
It depends on your metal level, so I checked, and it depends on your age. And it depends on your, actually it depends on quite a few things. Household income, how many members in the family, your age. I've seen plans this morning. I was looking for a man of 36 with close to the 12,000 threshold. He will pay 0 with a $650 deductible maximum out of pocket.
Let me ask you, the political debate informs the concerns you have. Insurers drying up in many Florida counties, concerns about where subsidies will go, about the very future of the Affordable Care Act. For some of you out there who rely on it, that's a big concern. For some of you who have no part of it and are part of the political debate about it, and you know that debate full well, what do you say? For those who aren't on it, don't like it, think it's an intrusion into the private markets, an intrusion into, you've heard all the debates, into our healthcare decisions. What do you say to those who oppose the Affordable Care Act about the impact if it dries up, is harder to get, or is much more expensive? What will it mean in terms of people?
I just want everybody to take a step back from the whole political debate. We all have a body. It's our engine, it's our motor. That's what we have to work with. And if it breaks down like a car, we need to have it fixed. We all have it, whatever color, whatever race, whatever age, whatever, you know, whether we're male, female, it doesn't matter. Health affects all of us. It's very personal to all of us. Whether you're poor or rich, it doesn't matter. So we can continue and politicize the debate, or we can, as a society, at some point say healthcare is a right, and we will figure out how to pay for it, all of us, and how to make sure that everybody can access it. Now, if you want to have super duper insurance, go right ahead and insure yourself up to the hilt, but there should be a basic menu of healthcare that we all pay for.
And to those who say the affordability has to be front and center on this, and to those Republicans who say it's skyrocketing premiums in many parts of the country, fewer insurers willing to be part of it, you say?
I say the lack of transparency in the cost of healthcare as a consumer. Like when you go to a doctor and you ask, you know, what is, I have a, you know, I need a mammogram. How much is the mammogram? You get no answer. It's the lack of transparency. So you as the consumer, even if you want to be a good consumer, it is really difficult to be one. And I think that's where government needs to step in and make that transparent to the consumers. We need to drive down the cost of health care.
And that impacts and helps us whether we're part of the Affordable Care Act or not. That's been a long time concern, that for so many things you can at least get some base prices on what something costs. It's very, very difficult, and most of us, because we push off the cost into the insurance pool, have never really worried about it or say, well, okay, that's the way it is. That's a fundamental problem that you see, whether you're a fan of or not of the Affordable Care Act.
It doesn't matter. We're all going to get sick at some point. We're all going to use healthcare at some point in our life.
How could we improve the model? There's a lot of argument that it needs a lot of work and that it's still very much a work in progress. What in your mind would help ease some of the criticisms about cost, about affordability, and make the plan work more cohesively for more people?
I think it would be important for people to understand, like for instance, people that have healthcare through their job. A lot of them, they access it, they do their copay, they really have no understanding of what the cost is. So maybe to start providing some visibility into what the cost of care is. Do I want to go to the emergency room? Or do I want to do this particular, or do I want to shop around?
The catchphrase always is, it's a government takeover of healthcare, and you say?
I say at some point as a society, I think we need to decide that we need to take a hold of our own healthcare. And if that's government, we pick our own government.
And in fact, right now, this is a public-private partnership. Right. There's public involvement, public money, but private insurers, right, a number of which you have named. In that sense, not altogether different from Medicare, right, which has been around for 50-plus years.
Right, and everybody you ask, do you know how many people I sat next to during open enrollment periods? They're like 64. Thank God I'm going to be 65 next year. To me, that's almost so sad to hear that. This is a young, vibrant society in America, and to hear that they made it till 65 so they don't have to worry about it, that to me is a sad statement.
The politics aside for Washington for now, for people at home, informationally, whether it's you or somebody you know, we want to put some stuff up on the screen on where they can go for help, because again, a dizzying array of plans. Let's put that up on screen if we can. Talk about where they go if they need help.
For Florida, one thing I also want to say, the Navigator program, even though they've been cut in their funding, they're still there. They can go to coveringflorida.org.
We see it on the screen.
Coveringflorida.org. They can go there. They can call 877-813-9115. That is the number that goes with coveringflorida.org, and they can ask someone to find someone local, a free in-person assister that will sit down with them to go over the plans.
Early on, but how are enrollment numbers looking? The Trump administration's not done much to advertise it. Navigator's being cut back. Do you think you're going to have as many people signing up, re-signing this year? What's it look like early on? I know you only have a few days as your litmus test so far.
Yeah, it's only been a few days. I know the phone lines have been extremely busy. I think people are really concerned about what's happening to my health care.
And your bottom line message was the one at the top, at least for 2018. One more time about availability and affordability in Florida.
Availability is there, affordability, it is pretty much the same as what I've seen last year.
And subsidies are there for the overwhelming majority.
Subsidies are there for the overwhelming majority. I recommend everybody, do not let yourself re-enroll or auto-enroll. Go on healthcare.gov, right, go on healthcare.gov and reapply and look through the plans. You might find a better plan that suits you better.
But for your organization, coveringflorida.org. So if you have questions, need to pick up the phone, need to go in and see somebody, coveringflorida.org.
Correct. Go there.
Is your place to go.
It's your place to go for Florida.
So that you can set up the help you need to sit down with somebody like you, right, who can help you wade through the choices.
And it's free. It's free. You don't pay for anything.
Coveringflorida.org. It's an ongoing debate. Many of the things you said are okay this year. We're going to have to wait and see what happens in the outbound years as Washington continues to debate it. But for the here and now, thank you very much for your time. We greatly appreciate you helping us maneuver through what is an enormously complex topic fraught with the politics and emotions on all sides. So thank you very much.
Thank you very much.
Thanks. And coming up, the topic of sexual harassment picks up in the Florida Senate.